We know that exercise can also improve the immune function, so our body's own ability to attack the cancer cells gets better. My name's Adam and I'm the exercise physiologist at Absolute Health and Performance. So my role as the exercise physiologist is to help people with chronic conditions better manage their conditions through exercise. So chronic conditions can involve things such as stroke, diabetes, osteoporosis, arthritis, cardiovascular disease and cancer, to name a few. Aside from that, I also help people rehabilitate themselves through sporting injuries. So sporting injuries can include anything from an ACL injury to tendinopathies to stress fractures, to name a few. So people who go through prostate cancer often have side effects to this. So some side effects can include cancer-related fatigue, sarcopenia, which is the decreased loss in muscle mass. They can also go through changes in body composition and they often present with decreased levels of exercise as well. So my aim for exercise for this population group is to try and rectify those issues. We know that exercise can help improve weight management, can help improve lean muscle mass and can also improve exercise capacity. We know that exercise can also improve the immune function, so our body's own ability to attack the cancer cells gets better. We also know through research that people who exercise, who are going through treatment cycles, their percentage of tolerating that treatment dosage that was initially outlined is better. Specifically with prostate cancer, we see improvements in PSA doubling time. So PSA is a prostate-specific antigen, so when prostate cancer cells become cancerous, they release this prostate-specific antigen, and we know through exercise that that initial PSA score that they get when they go through an exercise program, that doubling time gets a lot better. So the time that it takes for that score to double leads to a more favourable prognosis. Yeah, so I think everyone who works with prostate cancer patients will go through a different step-by-step process, but for me, I always start with initial consultation, and I particularly start with a specific ESSA screening, so it helps rule out kind of other associated conditions such as stroke, chest pains when they exercise, dizziness when they exercise, any other associated conditions, medications, injections that they've been on, whether they've been in hospital as well. Once that is all clear, then I go through specifically, I ask them a little bit about themselves, their family history of any other associated chronic health conditions. Then I talk to them about their experience with their prostate cancer. So I'll talk to them about treatment cycles, when they were diagnosed, things like associated conditions such as bone pain, urinary incontinence, and then I'll go through things such as overall injury history and exercise goals as well. Yeah, well, the movement screen for me is always individual to the person that I see in front of me. So I think for professionals out there, I think if you have a envisaged kind of set test that you do for every prostate cancer patient, so I think you can miss stuff. So I assess what is in front of me. So for example, if people complain about hip pain when they walk, then I'll assess their walking mechanics and assess what their hip does. If they experience low back pain, picking up things, I'll assess how they go pick up things, and then I'll do specific range of motion and strength tests on top of that to determine then what my exercise protocol will be. So overall, I think prostate cancer, yes, prostate cancer patients will come with, as I said, decreased exercise capacity and probably poor movement because they've been immobile. But prostate cancer specifically doesn't affect movement. So it's not like you've got a shoulder pathology in which you can't get your shoulder up or anything like that. I think it's because they're immobile, they will show signs of stiffness, low exercise capacity, low cardiorespiratory fitness and all those kind of things as well. So my first and probably the most important one is seeking professional advice. As I said, all the things that I've mentioned above need to be accounted for when designing a program, and I think if you go and see someone, you will get a program that is designed for you. The second one is monitoring your exercise program, so using things like a wellness sheet, blood pressure, heart rate monitors to track exercise intensity so you can see changes in their overall adaptations. And the third one is as a exercise physiologist who works with prostate cancer patients, it's not to wrap these people in cotton wool. They've come into the gym to improve their exercise capacity and improve their overall treatment of prostate cancer as well, to help them deal with all the things that I've mentioned above. So not wrapping them in cotton wool. If they're able to progress their exercises, means putting more weight on the bar or improving the repetitions or making the exercise difficult, I think is really important. So just natural steps of progression are key.